Hi, I'm Steve Rowe, CEO at Oaknoll. I'm recording this video the afternoon of Thursday, July 18th, and it will be uploaded and available to you by Friday, July 19th. I hope that you've been able to get outside a little bit over the past couple of days. It's just been absolutely gorgeous weather. And it's supposed to continue. I looked at my phone right before recording this, and for the next 7 or 8 days, the lows could get as low as the mid-50s and the highs no higher than 83 degrees. So just absolutely perfect weather after some of the hotter weather that we were dealing with just prior to this. So get outside, enjoy it while we can. I'll do a quick COVID update because there's not much to report. We had one staff member who was out with COVID, and that individual is back at work as of today. We also had 3 residents who were COVID positive last week as a result of some travel, and nobody is newly tested positive, and the 3 individuals who were positive last week have their issues have pretty much resolved. So nothing to report from a COVID standpoint at all. I want to talk a little bit about staffing changes that you've heard about over the last week. So on Monday, you received notification that our Chief Operating Officer for Health Services, Kim Bergen-Jackson, has accepted an associate professor position at the University of Iowa's College of Nursing. That is a great move for Kim. We're very, very happy for her and proud of her. We are going to miss working with her on a daily basis, but for Kim, it is just an absolutely great move. She will be able to share her passion for serving older adults with the next generations of nursing students as they come up and learn how to be nurses. Kim also is kind of uniquely qualified. She has a seat at the table and has met with the person who is the director of the Centers for Medicare and Medicaid Services. She's been in meetings with that individual, and as she moves into a professor position and away from her role here at Oaknoll, our hope is that she is able to influence policy at the national level. That's something that she has wanted to do for many, many years, and she's going to have the opportunity to do that. So Kim, we are so very, very proud of you and all that you've accomplished and helped us to do here at Oaknoll, and we know that that will carry forward with your new job. Kim is going to start teaching at the university August 21st, the beginning of the new fall semester. She will be with us probably until, I would guess, sometime in October as we hire for her position and then start that transition process. But we know that her teaching responsibilities will start August 21st, and her other responsibilities she can kind of phase into as she phases out of her Oaknoll position here. So that's what we know about Kim at this point. And then on Wednesday, just yesterday, you received notification that Josiah Miller-Dorer has accepted a position as a manager at the new hospital that's being built in North Liberty. Josiah was recruited into that job by somebody who he used to work with. You may not know this about Josiah, but when Children's Hospital opened many years ago, he was kind of one of the key people in cleaning the Children's Hospital and preparing it to open when it did. And he's going to be faced with a similar challenge and like doing that for the new hospital in North Liberty, although probably on a bigger in a bigger scope than he had years ago at Children's Hospital. So Josiah has been the best director of EVS that I have ever had the privilege to work with. He simplified things for our staff. When Josiah started, we were using something close to 100 different products, and he simplified that down to basically a handful of products that we use. Has been very respectful in working with all of our residents and really in tune to people's needs. And Josiah, we are going to miss you tremendously as well. Josiah's transition will happen a little bit faster. It's like he's given a month's notice, and we are starting the process of trying to replace both of those positions now. So for both positions, we want to be very deliberate about them and make sure that we are hiring the right person and not just the first person that we can. So we're going through a process right now, especially for Kim's position, to figure out exactly what we need. Is there anybody internally who may be qualified to grow into that job? And also looking at external candidates and what somebody from outside of Oaknoll may be able to bring to the table. So both of them are key roles. We want to make sure that we get it right, and we're going to go slow and deliberate to make sure that the person we hired is a good fit for all of us. I don't know if you can hear in the background, but there's a renovation going on in an apartment fairly close to my office, just upstairs, and they're doing something with flooring, so occasionally you may hear something that sounds like bees buzzing. It's just the work that's happening around me, and we're just going to keep going and hope that the sound quality is good enough that you can hear me. So that's kind of the staffing changes that I wanted to address. We will be okay. Our manager team is 20 people, and we're going to be losing 2 people here in the next month to 2.5 months, but that's 10% of our team. Our leadership team is closer to 50 people, so we still have a lot of people with tons of experience that know you and will continue to provide great care and service to you while we replace these key positions. So I want to talk about 2 other things. The first being an update on 1201 West Benton, the small house project. And first of all, I want to thank so many of you who have already made indications that you plan to contribute toward the project. Last week, Wednesday's semi-annual meeting and semi-annual remembrance program and meeting, we unveiled an ask and asked for some pretty significant financial contributions from our residents. And I'm so happy to report already that we have received indications of 4 room sponsorships already just a week into this effort. So to each of those individuals and everybody else who has indicated that you plan to contribute, it's like we certainly appreciate your generosity. Thank you, thank you, thank you. And it's only a week in, so it's been fantastic response so far. I also want to make sure that you know that every gift is appreciated. It does not need to be a $50,000 gift or a $1 million gift, although that would be really nice. But a $10 gift, a $100 gift, a $1,000 gift, a $5,000 gift, they are all appreciated, and all gifts will help us meet that goal of opening this new building and adding 12 additional nursing spaces for providing care to you and to your loved ones. So please, if you're thinking about it, if you have questions, I'd be happy to talk with you at any point to help facilitate that. Immediately, next steps that you'll see is within the next week or so, there should be a test drilling one of the 100-foot wells just to make sure that they know what the soil conditions are and everything that they're going to deal with as they build that geothermal system. And then by the second week of August, they should start the excavation work for the foundation. There is a lot of work that's happening on that project right now, but most of that work is still on paper. Our architects and engineers are taking the conceptual plans for the building and getting that into construction drawings. They're more than 50% finished with the construction construction drawings. By the end of July, they should be 100% finished with construction drawings. And that's a critical step because all the subcontractors will provide bids based on those construction drawings and what they see the project to be. So we need to have that work done. It'll go out for bid, and then it's like there are pieces of it that are already out for bid, especially the foundation work, and you'll start to see that work happening. By mid-August, we should be well underway with construction, and every day you'll then start to see changes in the building. By Thanksgiving time, the building should be weatherproof, and so there'd be a roof and walls and siding and windows so that they can continue to work through the winter. And the plan right now is that by mid-May, we should be operational in that building. According to our construction guys, that does include a 2-week weather delay in that schedule. So hopefully, if things go well, it's like by early May even, we might start to open that space. So that's what we know about 1201. Also, the last time I recorded, I talked a bit about the ACT possibility and the exploration that we were doing there. And what has happened since I last talked with you about that project is we met on June 26th with a team of architects, construction people, structural engineer, electrical engineer, mechanical engineer, and we toured the building. This was my third time kind of touring through the buildings, but the first time that some of those engineers had been in. And what we asked that team to do is look at this building really, really closely, because if we're considering acquiring this, we want to know everything we can about the mechanical systems, about the roof, just the condition of the building. What we found was a building or series of buildings that has been absolutely meticulously maintained, beautiful space, and 20-year-old space. And we know, roofs have a general useful life of 20 to 25 years. Mechanical systems, roughly about that as well. So while it has been very well maintained, we also need to plan for, if we were to acquire it, that within the next couple of years, we most likely would need to replace some of those things. So we've taken all of that information. They provided us renovation cost estimates for what it would take to take really nice office space and convert that office space into very nice apartments. And I built a financial model then, looking at all these costs and anticipated costs, and trying to figure out what could we reasonably offer to the developer. Last Friday afternoon, before I left work, I hit send on an email that was really an informal offer to the developer saying, hey, this is the property that we would like to acquire, and this is the price that we're able to pay. I don't expect that we will be able to buy it for the price that I gave him, but it is a starting point, hopefully, for some type of negotiation. We made the first offer. We didn't know his asking price. He had asked us to make an offer, so we've done that. We are hopeful that we will get a counter offer now as he has a chance to look at our offer, and that we can continue to work and find a price that will work for both parties. So that's what I know at this point. I know he has it. He said he would review it and get back with me. That has not happened yet. So until that happens, we're just kind of at a standstill on the ACT exploration, but it is potentially a really good opportunity for Oaknoll. The reason that is important for us is really two things. Number one, it would give us the opportunity to add some health services to the east side. So we have Oaknoll East Campus with 60 independent living apartments. We had explored adding assisted living. That didn't work out financially for us. This, I think there is a way that it would be much more feasible to add as part of an expansion of the East Campus. So we would be looking to renovate office building into independent living apartments. We would be adding an assisted living building almost immediately after we were able to figure this out, and also have the opportunity to add nursing spaces over there in time. So that's the first advantage, is adding health services to the east side. Second advantage is we have currently 281 households on our wait list, and this would give us the opportunity to expand our services to more people who would like to be Oaknoll residents and who likely, unless we're able to find a way to add more space, are never going to become residents, because our just normal process of apartments becoming available is only going to serve maybe 10% of that group each year, and people need to be served when they need to be served. So we hope that it's like by adding some additional capacity, we're able to serve a lot more people from the wait list who would like to be Oaknoll residents. Over the past year, we have added 56 new households to the wait list. 22 households came off of the wait list because they signed new LifeCare contracts, and 13 households came off the list because either they passed away, or they told us that they'd like to come off the wait list, or they no longer qualified for a LifeCare contract. So we had some households that have come off the list, but we still had a net gain of 21 households over the past year to get us to that 281 number. So that's just a lot of people who would like to be served by us that we will not have the opportunity to serve unless we extend our capacity in some form. So that's what we're exploring. All of this has to make financial sense, and we'll work through that. And financing is really the biggest hurdle that we will need to overcome if we are able to come to a purchase price with the developer. The immediate next step will be trying to figure out, okay, how do we pay for what we would like to do there, and does that involve a refinance of all of our current debt in order to make it happen? So still a lot of moving parts. I will try to keep you updated as best I can as things evolve over the next few weeks and few months. But that's what I am spending most of my time on right now, is trying to figure this out and find a way that we can serve more households. Hope you're all doing well. If you have questions, you know where I am. Please feel free to call extension 3006 or stop by my office. And if the door is open, I'm here. I'm ready to talk with you. Thank you. Have a good day.